Hello, my name is Nick Best. I'm an occupational therapist, and part of what I do is advise people on how to manage their breathlessness more effectively. In this video I'm going to be talking about the use of a handheld fan. It's important to remember that the strategies I'm going over in these videos are designed to help people with chronic, stable breathlessness. If your breathlessness has become suddenly worse, or if it's new breathlessness, then it's important to get medical advice. So, one of the strategies that a lot of people swear by when managing their own breathlessness is the use of a handheld fan like this one, or similar. Other people like to have bigger fans blowing on them. Some people like a window open to feel air coming in onto their face. Studies have shown that these sorts of interventions, particularly the handheld fan, do reduce the experienced feeling of breathlessness. So it's an evidence-based strategy. It's not entirely clear how it works, but a way that it is thought that it might work is something called the dive reflex, which is a reflex that all mammals have from sensors around our nose and mouth, can sense through temperature changes and such, like when our face is underwater. Now, obviously when your face is underwater you can't breathe, so your body reacts to that situation by redistributing the oxygen within your body so that more goes to vital organs like the brain and heart. So it's thought that possibly that using something like this to blow cool air onto that area of your face may in some senses trick the body into thinking that your face is underwater. The oxygen is redistributed within your body in such a way that it reduces the sensation of breathlessness. Whatever the reason is, it's known to help a lot of people, so it's worth you experimenting with. So see if you can get hold of one of these. If you're one of my patients in our service, we should be able to give you one to have. And when you've got it, the way to use it is to hold it about 12 to 15 centimeters away from your face and just gradually and slowly move it, all the while pointing at this sort of area around the nose and mouth. Now obviously you can combine these with other strategies, but this is a really good one. It makes people feel more prepared, more empowered, because they can carry a little thing like this around you wherever you go, and when you're got your breathlessness coming on, you can take it out and blow it on yourself, and it provides people with a lot of reassurance as well as the practical effects of it. So that's how to use the handheld fan, and I'd advise you to give it a try and see whether it works for you. So to summarise, over the course of this set of videos I've given you a range of techniques that you can use to reduce the effects of breathlessness on your quality of life and reduce how much it affects your ability to function and do the things that you want to do. It can be difficult to remember exactly what to do when an attack of breathlessness comes on, because as we've discussed, it can bring on great feelings of panic and anxiety, and that's not the best mental state to be in when we're trying to remember what to do. So that's why I'm hoping that these videos might be useful in giving you something that you can go over and make it more ingrained in your memory, the strategies that you can use. If you're part of our service, we'd also have given you handouts to this effect, and there's information on the internet also. The website of the Breathlessness Intervention Service at Addenbrooke's Hospital in Cambridge is a particularly good one with some wonderful handouts that they give to people, so please check that out as well. So to summarise, what are the strategies that we've talked about? We've talked about emotional coping strategies, remembering that it's not by and large as scary as it feels, and remembering that anxiety can cause breathlessness. Breathlessness can make anxiety worse, and so often reducing the anxiety can reduce the breathlessness also. And whatever strategies you have for reducing anxiety will be useful, relaxation strategies and so on. We'll go over any strategies individual to you in person if you're one of my patients. We've talked about patterns of breathing themselves, which, as well as being effective breathing techniques, they also send a message to your brain that things are okay because I'm doing calm, deep breathing. We've talked about breathing from the diaphragm rather than the chest, and you can do that by putting your hand on your tummy and feeling as you breathe in, your tummy comes out. That's the most important thing to remember about the breathing techniques, the relaxed tummy breathing. There are other techniques as well. Go back to the breathing video if you need a reminder. We've talked about positioning. The common positioning techniques that are useful are leaning forwards with the arms supported, or standing in such a way that your shoulders are back. Also, many people find being more upright in a bed while sleeping is useful. The important thing to remember about positioning is that it's even more individual than the other strategies, so experiment with different positions and do the ones that are most useful for you. And we've talked about, in this video, we've talked about the use of a handheld fan, which also many people find extremely useful. So that's a whole battery of techniques you can use, and you can use them all at the same time. You can do your relaxed tummy breathing with the oblong and the pursed lip breathing all at the same time as you're in a recovery position that helps you to recover the most from breathlessness, at the same time as you're holding a handheld fan. For example, the extent to which you can use all the strategies simultaneously is limited only by your ability to remember them all, and as you practice more, it'll be easier to remember them all. Perhaps writing them down or using one of our handouts can help you initially, but the idea is that they'd all become second nature and make it much easier for you to manage this symptom. So I hope all of those are helpful. We're thinking of you. If you're part of my service, please call me if you want to go over any of these things. I will have spoken to you on the phone anyway, but please don't be afraid to call. And anyone who's not from our service, I hope you found this helpful, and I might produce some more if it proves to be useful. Best wishes to you all. We're thinking of you, and we're hoping you can manage your breathlessness as best you can and have as good a quality of life as possible. Best wishes from all of us.